Recent research reveals that approximately 40% of individuals worldwide living with diabetes remain undiagnosed, marking a concerning global health issue. This data stems from the 2023 Diabetes Global Industry Overview, which stands as the most extensive survey of its kind to date. The report highlights that the majority of undiagnosed cases are concentrated in Africa, where a staggering 60% of affected individuals remain without a formal diagnosis. This is followed by Southeast Asia, where 57% go undiagnosed, and the Western Pacific region, with 56% of cases undetected. Worryingly, the report also underscores that even when diagnosed, half of those with diabetes do not receive the necessary treatment. This dire situation is particularly prevalent in low- and middle-income countries, where healthcare services are often inaccessible to a significant portion of the population. Sasha Korogodsky, the lead researcher behind the report, points out that limited healthcare infrastructure, including a shortage of healthcare professionals and diagnostic equipment, can impede the early diagnosis of diabetes. Tragically, the consequences of this widespread issue are stark. In 2021, diabetes was responsible for nearly 7 million deaths worldwide, despite an expenditure of over $970 billion, £794 billion, on treatment. Interestingly, the landscape of diabetes drug production is heavily skewed. Over 70 companies engaged in diabetes drug manufacturing, with 55% of them situated in the United States, and 17% in Europe. Remarkably, the global diabetes market is primarily dominated by 4 major conglomerates, collectively accounting for around 72% of the market share. The alarming rise in diabetes is attributed to various factors. Rapid urbanization and the adverse impacts of climate change on crop yields have led to an increase in affordable processed foods, displacing traditional dietary choices. Coupled with a shift towards sedentary lifestyles, particularly in urban areas. These factors contribute to an elevated risk of developing type 2 diabetes, hypertension, and certain cancers. This multifaceted challenge calls for concerted global efforts to address the root causes and improve access to diagnosis and treatment for diabetes.